So we will now proceed to the different laboratory tests to measure liver functions. Okay, so the first one is the test to measure the hepatic synthetic function. So one test that can be done to measure the synthetic function of the liver is the determination of total protein. Okay, so remember, guys, that total protein does not need fasting. Okay, so fasting may not be required for total protein. And we have two methods for total protein determination. One is the Kagedal method, and we also have the Bioret method. So from these two methods, your Kagedal method is being classified as the reference method for protein determination, although it is not the routinely used method. Okay, so this is actually based on the measurement of the nitrogen content of protein, and the end product is ammonia. Okay, the next uh, method is your Bioret. Okay, your Bioret method, the most widely used, especially for chemistry analyzers, okay, automation in the laboratory, in which a protein can be measured, okay, down to 10 or 15 mg per dl. So what is good about the Bioret method is that it has a high sensitivity reaction, okay, when protein is being measured. So it has the quality to measure protein even at low concentration. Okay, so the Bioret method is also the most commonly used method that can be found, okay, or that can be used in the clinical laboratory, okay, especially in the clinical chemistry section. Another method for the to measure the synthetic function of the liver is the serum electrophoresis. So this is actually a more advanced method in which we are using a power source. Okay, so it uses an electric current, and also we are also using gel. Okay, gel, in which onto the gel, okay, it has sample wells in wherein we will put the sample and the reagent. Okay, so when you talk about electrophoresis, this is actually based on the principle of migration. Okay, so based on electric charges. So for the procedure, okay, so we will test the ability of a particular analyte to migrate, okay, from the negatively signed electrode to the positively charged electrode. So the one that is negatively charged is your cathode. Okay, so your cathode, okay, is the one that is negatively charged. Okay, I'm so sorry for the penmanship. Okay, so cathode. Okay, so that's cathode. Okay, and the region that is positively charged is your anode. Okay, that's A, anode. Okay, that's ANODE. So that is the positively charged electrode, and the cathode is the negatively charged. So we will try to identify the ability of a particular analyte to move or to migrate from the cathode to the anode region. So this is also used to classify the five major types of protein. So we have your albumin, your alpha 1 antitrypsin, your alpha 2 macroglobulin, and your gamma globulin or your immunoglobulin. So this is actually the result of the serum protein electrophoresis. So after the particular sample is subjected to protein electrophoresis, so the different types of protein are now being classified or are now being divided. So always remember, guys, that the fastest type of protein that will migrate to the anode or the positively charged region is your albumin. Okay, followed by your alpha 1 antitrypsin. The third is your alpha 2 macroglobulin, your beta globulin, and your gamma globulin. So it's your gamma globulin or your antibodies who um who uh which travels far away from the anode or the positively charged region. So this is actually the normal uh, electrophoretic pattern, okay, for serum electrophoresis. And also, electrophoresis also serum electrophoresis is also used to diagnose different disorders. So we have here for this first picture, okay, this is actually the result of a sample or if a patient with multiple myeloma. So for those who do not know, multiple myeloma is a malignant disorder of the white blood cells in which there is overproduction, okay, and appearance of malignant plasma cells. Okay, so in multiple myeloma, if you can see, this is actually the normal pattern, right? But if you can see for multiple myeloma, there is an increase in the gamma globulin. Okay, so there is a gamma spike. There is an increase in the gamma globulin due to the overproduction of plasma cells. So this is the electrophoretic pattern for multiple myeloma. On the other hand, when you talk about hepatic cirrhosis, okay, so this is a hepatic disorder, right? Scarring of the liver, okay, leading to inflammation and any other complication. This is actually the electrophoretic pattern, okay, for uh, a sample with hepatic cirrhosis. So if you can see here, diba, we can actually see the beta and the gamma levels, right? But pattern. Okay, so it is actually being divided here in a normal pattern. But for hepatic cirrhosis, there is a unique pattern known as the beta gamma bridging, in which the beta and the gamma uh, levels are being joined together. Okay, so makita ninyo guys, diri medyo ni curve pa, right? Ang beta, okay, towards your gamma. But here, beta and your gamma are being connected with each other. So it formed a bridge between these two type of proteins. So this is a unique feature for hepatic cirrhosis. On the other hand, okay, on the other hand, if this is the electrophoretic pattern for nephrotic syndrome. Okay, so nephrotic syndrome deals with kidney failure. Okay, kidney failure. Okay, so especially in the aspect of the filtrating capacity of the kidney. Okay, so this is the electrophoretic pattern, and you can see that this one there is an increase in what? Alpha 2, right? So this is actually the albumin. But if you can see also here from this picture here, there is also an increase of alpha 2 levels, okay, for nephrotic syndrome. So remember that for nephrotic syndrome, there is an increase of alpha 2 uh, macroglobulin. Okay, for hepatic cirrhosis, there is the bridge between beta and gamma. And for multiple myeloma, there is an increase in the gamma globulin. There is a gamma spike, okay, from the electrophoretic pattern. Okay, so this is also the electrophoretic pattern, okay, for inflammation, right? So if makita nato guys, number one na increase is your alpha 1, right? Increase in alpha 1, increase in alpha 2, and also there is also an increase in uh, beta, okay, the beta globulin. Okay, so there is also an increase in the beta globulin for inflammation. So for patients experiencing inflammation. Okay, so let's go now to some other tests. So this particular test measures the conjugation and excretion function of the liver. So first is, again, we have the serum bilirubin determination, right? So you learn na in the past video about the production of bilirubin, right? So we have two methods, okay, under serum bilirubin determination. So one is Evelyn and Malloy, and the other one is Gendrasik and Groff. Okay, so when you talk about Evelyn and Malloy, so the main feature or the thing that you have to remember for Evelyn and Malloy is that it uses methanol as a coupling accelerator. So what do you mean by coupling accelerator? So this is actually added to the test. It will act as a dissolving agent to remove albumin from bilirubin 1. Di ba we all know that bilirubin 1 binds to your albumin, right? Because your albumin will transport bilirubin 1 to the liver. Now, if we want to measure bilirubin 1, okay, we have to make sure that we don't include the albumin in measurement. That is why we add a coupling accelerator, okay, in the form of methanol for Evelyn and Malloy. For Gendrasik and Groff, we are using caffeine sodium benzoate. But if you want to compare the sensitivity between Evelyn and Malloy and Gendrasik and Groff, it will tell you that Gendrasik and Groff is more sensitive compared to Evelyn and Malloy. Okay, then another thing you have to remember in bilirubin determination is that bilirubin must be protected from light, right? So that is also part of when you transport blood, okay, especially if the test is for bilirubin, we have to protect the tube that contains blood from direct exposure to light. Okay, so what we can actually do right after blood collection, we can actually wrap the tube with dark paper, and we have to make sure that it is fully wrapped so that there will be no light that will penetrate onto the tube. Because if the tube will be exposed to light, okay, it will actually lead to uh, the breakdown of bilirubin. So it will lead to false decrease in the bilirubin level. So that's what you have to remember, guys, for bilirubin, ha? The sample should be protected from direct light. Another one is your enzyme test. So also your bilirubin, okay, also secretes enzyme, right? And we can actually use enzyme to test for the detoxification function of the liver. So we have a lot of enzymes that is being secreted by the liver. So we have alkaline phosphatase, okay. Usually, alkaline phosphatase can be also used to diagnose bone disorder. Okay, bone disorder. We also have alanine aminotransferase. This is actually the most specific liver enzyme. So whenever there are injuries in the liver, okay, inflammations, conditions pertaining to the liver, this is the first enzyme to rise, alanine aminotransferase. You also have your aspartate aminotransferase. Okay, this is also a liver enzyme, but this will also rise in cases of myocardial infarction. Okay, myocardial infarction. Then we also have your gamma glutamyl transferase. This is the enzyme, okay, used, okay, to know or to diagnose chronic alcoholism, because patients who are alcoholics, okay, we're having severe alcoholism, usually mo increase ang atong gamma glutamyl transferase. Okay, so for those of you who love to drink or who love to party, so at least okay, make sure that you have your gamma glutamyl transferase check. Okay, just to know that your liver is still healthy. Okay. Then we also have your ammonia test. Okay, so your ammonia test is used for the detoxification function of the liver. Di ba we all know that your ammonia, okay, arises or comes from the deamination of amino acid, right? Which is due to the different uh, bacterial enzymes, right? Uh, Also, your ammonia is also used to diagnose hepatic failure. Okay, and also we have to know that increased levels of ammonia in the body is not healthy. Okay, take note, ammonia is a toxic product. So if ammonia is increased, especially in the plasma level, it will actually cause toxicity, especially when it reach to the central nervous system. It can be toxic, okay, to the central nervous system, leading to death, right? Leading to stroke also. Okay, so we ammonia is considered as a toxic substance. So whenever we want to measure ammonia, we have to make sure, or we have to consider different uh, procedures or different ways to prepare the patient. Number one is when we want to test for ammonia, we have to make sure that the patient does not smoke, okay, for a couple of hours, okay, prior to testing, because smoking is the number one source of contamination. Then we also need to process immediately the samples, okay. We have to avoid prolonged standing, and the preferred specimen for ammonia testing is your arterial blood, okay. And the preferred anticoagulant is heparin, or you can actually use EDTA, okay, for fasting samples. Okay, so EDTA. Okay, so let's go now to the different tests for pancreatic function. Okay, so number one is we have the serum amylase determination. Okay, so your amylase is also produced in the pancreas. So the major source is your acinar cells of the pancreas, and also this can also be produced by your salivary glands. So amylase is very important, especially in the breakdown of starch. Okay, so for amylase. So also, take note, this is the smallest enzyme and also the earliest pancreatic marker. So, meaning whenever there are diseases involving the pancreas, amylase is the first enzyme to rise. Then we also have your serum lipase determination. So always remember, guys, that lipase is the most specific pancreatic marker. Okay, because this is only produced exclusively in the pancreas. That's why for pancreatic diseases, okay, for conditions involving the pancreas, the best marker or the best test to do is the lipase determination. Okay, for amylase lang, although it is also used to diagnose pancreatic disorder, but amylase has a lesser sensitivity compared to lipase, because amylase, there are other cells, okay, or glands who produce amylase. So we have salivary. But for lipase, it is only exclusively produced by the pancreas. So this is the best pancreatic marker. Okay, then the method for the serum lipase determination is your Cherry Crandall method. This is the reference method for serum lipase. So hi guys, it's me. So thank you very much for watching the video. Please click, okay, to subscribe. Just joking, okay. So I hope you learn a lot, okay, from the concepts and the topics that I presented to all of you. So if you have any questions, do not hesitate to contact me, so maybe there are some things that might confuse you, okay. So I hope you learn from the different functions of the accessory organs, right, and also in the aspect of bilirubin metabolism and production, and the different laboratory tests used to measure the functions of the accessory organs of the digestive system. So before I will end the video, again, nanapukoy mga parting words para ninyo, right? So something to ponder. So according to John Wooden, you have to make each day of your life a masterpiece, right? So what does it mean, right? So I know we are in the state of uncertainty right now, right? We don't know when this pandemic will end, and we don't actually know when can we go back to our normal lives, right? But one thing that I learned, okay, from this pandemic is that you have to live uh, your life in the best way that you can each day, right? So each day that we wake up, we always we need to say thank you, right? That we are given a new day to improve ourselves, right? And to do better and to do the things that we want. Okay, like let's relate this to your red blood cells, right? Your red blood cells is only given 120 days to live. Can you imagine if ikaw, maingnan ka na, uy, nanana kay 120 days to live, right? So, what will you do with your remaining time, right? But for the red blood cell, wala siya time na gipalapas, right? The red blood cell actually maximizes the time that gihatag niya. So, the red blood cell performs its functions properly, and 120 days is enough na, okay, for a red blood cell to perform the different functions niya or responsibilities. So, kita po, although we don't know our time, okay, when ta mo hawa, right? Okay, we have to live, okay, each day, okay, in the best way that we can. So I think we all need to do is just spread love, right? No hatred, and always strive to be the best versions of yourself. Okay, so I know you're still adjusting, but actually that is really the process, right? We really have to go to the process. Even me, this is really a big adjustment in my part since I am not used to this. So I was really kanang forced to make a YouTube channel lang jud, just to provide a way that this video will be viewed by you guys. So I think we all have adjustments, right? So that's why patience also is really important. Patience, okay, incorporated with hard work, okay, and being faithful to your work. So that's it, guys. Thank you very much. So see you all, okay, for our next topic. Okay, so God bless, be healthy, stay healthy, and keep safe. Bye bye.